This was a patient by the name of Beatrice Marshall. Are you familiar with that?
No, not at all.
It was
So
in the
we
US.
did.
That's a shame because did she talk to our manager?
I talked to her daughter yesterday, and she said she's been calling, has not been able to get a response.
Really? Let me take that name.
Is there a chance for Mrs. Marshall to maybe get a refund?
Sure. She would have to discuss it with the manager, but yes.
It's possible.
Yes. We have done it before.
The clinic did offer to redo Mrs. Marshall's crowns. She said no way. Her request for a refund was denied. She could sue, but Mexican law makes it almost impossible to sue for malpractice.
Welcome to Mexico.
That's another reason dental care prices are so low in Mexico. But there's a bigger one.
Typical take-home pay for a dentist in Mexico is about $25,000 to $30,000 per year. And a dentist in the U.S., the last time I checked, the average profit take-home pay for a dentist was about $150,000 a year.
Dentists in the U.S. say there are good reasons their colleagues in Mexico make so much less money, starting with their training. The Autonomous University of Ciudad Juarez is home to one of Mexico's major dental schools.
The student is in the last semester in the school.
Students at this university clinic were in dental school the day they started college.
Well, we have the program in semesters. They can be a dentist with 10 semesters.
That's 5 years total, compared to the U.S. requirement of 4 years as an undergraduate and another 4 years in dental school. American dentists say that's why the U.S. has no dental school accreditation agreement with Mexico as it does with Canada.
I'm an El Paso native.
So what's an American like Mario Villegas doing studying medicine in Juarez?
It's more focused.
Mario went to an American college for 2 years. He says here he studies medicine and he isn't forced to take unrelated courses. So he believes he's learning more in less time.
The first 2 years, you focus on pure basic sciences oriented towards medicine. I think education and training are at a magnificent level right now.
Better again? It's better?
Yeah.
Okay.
Rio Dental in Juarez opened its doors in 2005. Its dentists graduated from university dental schools throughout Mexico. And no matter how much experience they've got, they're still required to take courses to upgrade their skills.
We need to take this 2 times a year.
But most patients coming to Mexico rely mainly on word of mouth or mouse.
They found us on the internet, and we've had patients visit us from just about every state in the U.S.
The questions that I always have with the patient about the water.
Sometimes patients ask if the clinic uses distilled water or if it has the same kind of sterilization units used in American clinics. But a lot of people are like Bill Spencer,
Right now, I'm gonna take it off.
who drove all the way from Alaska, guided by little more than Rio Dental's website and a friend's new smile.
The front feels really good. This back one still feels a little high.
I'm always surprised that people are just simply willing to say, well, if someone else had a pretty good experience and the price was right, I'm not really going to question the credentials of the doctor that I'm going to go see.
Bill Spencer has no complaints about his dentista's credentials or his work.
Yeah, it looks good. I had an Novocaine here, so it looks like when I was, younger, and I'm happy.
This is another case where the patient went to Mexico.
At any given time, Dr. Stephen Caldwell says he's got 5 or 6 patients who went to Mexico for a good deal and came back with a great deal of pain and trouble.
I'm sure they're very well-trained doctors. I think they're very experienced people. I just don't know who's who.
Your place warranty 1 year full.
For Jean Dowdy, using a referral company like Dayo Dental answered a lot of questions and saved a lot of time, on top of the $1,800 she's saving on her dental work. Americans coming to Mexico say they respect the skill and dedication of dentists back home, but they don't believe American dentists have a monopoly on quality.
I always say that we have to face the fact that not all the qualified professionals are in this country. There's a whole world out there that have equally qualified dental professionals.
All along the border, a reverse migration of dental refugees is growing.
I don't have my bottom teeth in now, so don't get a close-up, buddy.
And a discount dentist in Mexico can even beat one in the family.
My son is a dentist in Houston, and so he had wanted me to come to Houston to get this done.
That was before he saw the bill from his dad's dentista and the finished product.
How did your son think your teeth looked?
Great. In fact, he's coming himself.
We all set?
Lou Edmonds, Gene Dowdy, and Tony McKernan load into the Dayo dental van for the 200-mile ride back to Phoenix.
Very successful day, and everyone's happy, and we had a great time.
In 2 weeks, Dayo will lead another migration of active seniors to Los Algodones, while American dentists look for some way to win the showdown with Mexico's border town dentistas. The way things are going, they'd probably settle for a Mexican standoff.